Liposculpture Talk, Episode 5. So what's liposculpture? The term liposculpture, is that any different than traditional liposuction? Well, it turns out liposculpture is used to distinguish traditional liposuction from body contouring. So it's not just about suctioning fat from the body. It's about reshaping the body by removing and sometimes adding the right amounts of fat into the proper areas. Liposculpture is truly body sculpting, which means you need to have an aesthetic eye. So liposculpture is
really about reshifting fat. It's about distributing your fat in a much better place so that now we can create natural, more beautiful results. So that's why almost anybody is a candidate for this procedure, because I'll take women that are full figured, and what I'm doing is creating shape, creating contour and waistlines. And so it's about reshaping them, not about getting them to lose weight. But now, if I do reshape them, they gain or lose weight, they always maintain a sexier, prettier look.
That's Dr. Constantino Mendieta. We heard from him a little bit in episode 2. That's the episode that chronicled Jasmine's Brazilian butt lift. Dr. Mendieta is in Miami, the butt augmentation capital down there. He's been named one of America's top surgeons for 5 years in a row by the Consumer Research Council in America. He lectures around the world. In fact, when I first contacted him a couple weeks ago about this episode, he was lecturing in Australia about his signature butt enhancement technique. So he says that liposculpting is difficult to do well and requires a very artistic eye and excellent surgical technique. So to really understand liposculpture and to understand it's not just suctioning out fat and that it's forming, it's contouring. So you really have to understand fat. How does fat work?
In order to understand that, we really need to see how fat is created. And the way it starts is like this. Up until puberty, your body has a fat-making machine that will produce actual fat cells. Brand new cells are being created. It'll then go to your genetic boss and say, hey boss, where should I go? And some people it goes to the outer legs, the love handles, inner legs, or the muffin top, which we all hate. Now, at the end of puberty, that machine will completely shut off. Factory is closed. So now when you gain or lose weight, the fat cell actually does what we're doing, and that is that it gains weight or loses weight. So it gets bigger or it gets smaller. It doesn't disappear and come back, so the number of cells always stays the same. So now what you see is whenever you gain weight, there's a particular area in your body that you always notice at first, whether it's the outer legs, the inner legs, whether it's your waist, wherever it is. And then this is the place where you never see it go away. Yes, it shrinks and it gets smaller, but it never really goes away. It always remains fuller. And that's because you have a distribution of fat issue, meaning that your genetics put more cells in that particular area and you will never, ever be able to get rid of them.
So liposculpture is not about weight loss. It's about distributing your fat in a much better place so we can see a more natural, beautiful result.
But now, if I do reshape them, they gain or lose weight, they always maintain a sexier, prettier look.
Okay, so now that we understand that fat doesn't just come and go, fat cells just don't disappear and reappear again. They're fixed. They just get bigger or smaller. So another question that Dr. Mendieta frequently gets is,
well, what happens to my fat after you suction it out? What will happen to my body? Will it grow in other parts? Will I get bigger arms, bigger legs? But what I've done with surgery is that I've rechanged your fat distribution so that now when you gain or lose weight, you're right, you're not going to see it as much in the waistline, but you may see it now wherever you have more cells. That could be your arms, your legs, because we did not touch that area. I mean, these cells can't grow back unless you get morbidly obese. That reopens the factory, and now is a whole different story, but that's not going to happen. So the common question is, what happens when I gain or lose weight? Now, I always chuckle at that because I hope we're not planning on gaining weight already, but if you did gain the weight, you're just going to see it in areas that you didn't do liposuction in, or wherever you have more fat cells.
liposculpture. So it's not just about suctioning fat. It can involve taking fat out of one body part and adding or augmenting it to another. It could be the buttocks, the breast, the calf, whatever. And it could be using your own fat cells. So, Dr. Mendieta, where do you typically harvest the fat from?
Well, it completely depends on what area I'm trying to accentuate. Let's take the male pectoral zone. If I wanted to emphasize the pectoral muscle, I'll take fat from the lateral chest wall, some from the back, I then transfer that fat into the muscle so that I'm accentuating the muscle and de-emphasizing the areas around it. Essentially, I'm framing that structure so that it looks more aesthetic and it looks nicer. But oftentimes I'll need more fat. So if I do, then I'll go to other areas wherever you may have it. It could be the abdomen, the outer legs, the inner legs.
So what happens if they don't have enough fat? If they are skinny, they don't have enough fat to harvest from their abdomen or back. They're just skinny and they want to enhance their butt size.
Well, oftentimes what I'll do is before surgery, I'll assess the parts that I'm trying to augment, whether it's the breast, whether it's the calf, whether it's the buttock. And if I don't think you have enough fat, then guess what? I send you to booty camp.
Booty camp. What's that?
Well, that's a camp where you get to eat whatever you want. I'm actually asking you to gain weight. You could gain anywhere between 5 to 20 pounds, depending on the particular augmentation we're trying to do. It becomes a lot of fun. It's the best prescription you're ever going to get in your life.
I bet.
I'll be removing this fat, so that's not really a concern, and patient tends to lose that fat fairly quickly once they've had the procedure.
When Dr. Mendieta speaks, when he lectures, there's 2 facts or 2 truths about the buttock that he always speaks of.
Number 1, everybody has one. Number 2, Jennifer Lopez, Kim Kardashian, and my wife have a nice one. So let's go back to the first one. Everybody has one. Well, in order to understand this concept, we have to go back to what we talked about in terms of fat and how it works. You were genetically predisposed to have fat distribution patterns in your body. These cells cannot disappear and come back because that factory of fat making shut down at puberty. So you are now predetermined for the rest of your life genetically to have more cells in certain zones. That will not change with diet, with exercise, or anything that you try doing because you will always have the same number. The cells aren't disappearing and coming back, they're just getting bigger and smaller. Now, I found through my evaluation system and classification system that there are 4 different body types when you're looking from the back. And that is the V shape, the A shape, the round shape, and the square shape. Now again, remember, whatever body shape you are born with, you will have for the rest of your life. So what we do through the 3-dimensional body contouring, we remove and shape the body frame first in the buttock area by removing that fat. We then add fat to the muscle to accentuate curves, shape, and contour, reshaping your body forever.
Let's take the second truth now.
Jennifer Lopez, Kim Kardashian, and my wife. What you are looking at when you see them is not necessarily the size, although that's what really attracts you at first. It's really the body proportions that you're looking at. They have a smaller waist and a larger buttock. That proportion that you're seeing, there's a magical number that Deidre Singh came up with. He was a famous psychologist who traveled the world. He drew different figures of women with different waist to hip ratios, meaning if you take your measurement at the point of your waist and then you take another measurement at the widest point of your hip and you divide those numbers, you're going to get a ratio. Deidre Singh presented these photos of women with different ratios varying from 0.5 all the way to 1 or greater than 1. And he showed these pictures to the high elite people in New York City at the Penthouse Apartments or Park Avenue, wherever you want to call it. And he took it to the Amazon and showed it to the tribal people that were there. They looked at these pictures, and what they found is that there was a commonality between what they found to be beautiful or attractive. And it seemed to be the same ratio in everyone. That ratio was 0.7.
Sweet. Look at that 0.7 she has. Yeah, nice.
Now that we have this ratio determined as 0.7, that's not the only component to contouring the body. The next component is the shape, the buttock shape.
Now, buttock shape is a little bit different because that will have a tremendous amount of cultural influence, race influence, and social preference in terms of what you determine to be the best shape of your buttock. Oftentimes you'll hear of a heart-shaped buttock where there's a little bit more fullness in the outer part of the lower buttock. Some patients want more of a shelf. A shelf means more fat in the upper buttock so that when the back meets the buttock, there's tremendous curvature accentuating the gluteal zone. Other patients prefer a taller and less wide buttock. So the shape of the buttock is completely individualized, but the ratio is universal.
Dr. Mendieta, thank you so much for joining us today. I'm Chris, the host of Liposculpture Talk, and I'd like to thank anybody else who has given us a rating on iTunes or Stitcher. We're a new podcast, and I certainly appreciate any feedback or rating we can get. We've had 2 ratings so far on iTunes, and I do read them, and it would be great to have more. It would mean a lot to me. The best way to get a hold of me is to contact me through Facebook. If you have any ideas for a show or any ideas for a guest, let me know. I'd like to hear from you. I want to chat about liposculpture. If anybody wants to get in touch with Dr. Mendieta, his clinic is in the Miami area in Florida, and his website is constantinomendieta.com, or you can telephone him at 888-251-6487.
Thank you for calling for beauty, the office of Dr. Constantino Mendieta. If this is your first time calling and you're interested in a procedure, please press 1 so one of our counselors may assist you. If you are an existing patient or have any other question, please press 2. If you are the media, please press 3. Thank you for calling our office and have a beautiful day.